Dr. Yager, the use of subliminal therapy for the treatment of individuals with personality disorder is very intriguing to me. Harkening back to my training in psychodynamic therapy, it is said that people with personality disorders, narcissism, borderline personality disorder, antisocial personality disorder, cannot be treated with insight-oriented therapy. So perhaps you're suggesting that subliminal therapy effectively goes beyond insight-oriented therapy and shows the individual a part of themselves that ordinary psychodynamic therapy does not access. And if that's true, how does that occur?
Well, Carla, it occurs because by engaging their higher level of abilities, they are able to do things that they cannot consciously do. The limitation of classic insight therapy treatment, psychodynamic treatment, is limited by the patient's conscious awareness. And if the patient doesn't consciously know what's causing the problem they present, they're helpless. They can't deal with it if they don't know what's causing it. Well, the clinician certainly doesn't know what's causing it. Something else has to be, some other door has to be opened. And that door is through their higher level of intelligence. This level that they probably don't even know they have. They don't even know it exists. And are consistently and sometimes humorously surprised to find that they have that ability. You know, well, where did that come from? Kind of a reaction. In using that level of ability, it's not just spontaneous insight. It's a concerted, focused mental exercise at this higher level of a functioning. See, the patient can do things utilizing that level that they can't do consciously. We have severe limits to memory, to extrapolation, to all kinds of mental capacities are limited consciously. And at that higher level, those barriers don't seem to exist. Memories that are not available consciously are available at that level. The ability to, I use the term investigate a problem by review of memories, by engaging abilities that I don't even know how to talk about, seem to take place, such that in the end, that higher level of ability is able to truly identify the true roots, the true cause of this presenting problem. And then the clinician guides the process, guides that higher level of ability to resolve that by education about present reality. It seems that that part of the mind that is formed in this traumatic situation back there in time that's creating the current problem, and there may be more than one part, but picking on any one you want to pick on, that part is using its influence in the best interest of the patient, but based on its understanding. And its understanding is limited to what the patient knew when that part was created. Freud talked about arrested development. This is kind of similar to that, applied to a given part. in some situation, maybe traumatic, when that part is created, that part, that influence, comes into existence in the life of the person, knowledge of that moment is retained. And it's like that part of the mind is arrested. That part of the mind is not aware of present life. That part of the mind is functioning, its functioning is limited to what it knows. And all it knows is what was happening then. So the task of that higher level of ability is to re-educate that part, recondition that part by education.